Hi, everyone. I see some new faces on here, so I'm just going to introduce myself. My name's Jen Ritchie. I am the RIDOH Scholar Program Manager, which is our internship program. Public Health 101 is part of our internship program. It's something that we offer to our scholars, but we also welcome RIDOH staff to also join us, especially if they're newer and maybe don't know the other work that is going on in the department. So today we have a presentation from the Maternal and Child Health Program. I'm going to pull up the slide deck, and then Aida, you can introduce yourself. Let me
Hi
share
all.
my
It's nice to see you all. Hello to Natalia, Kyle, Judith, Joseph, Megan, Sophie, and Kelsey. Thanks for joining today. I really appreciate it. So I'm from the Maternal and Child Health Program. My actual position is a disparity specialist. So I look at across all of our health domains. We have 6 of them. Look across all of them and think, oh, where are the disparities here? Which groups of people have the most poor health outcomes or most poor health access? And how can we fix that? Next slide, please. So the MCH program, it refers to all work the DOH does that touches women, children, and their families. So we oversee a lot of different programs and then go to those programs, especially with me. I go to those programs and I say, well, it seems you have a disparity in this. How can we coordinate in order to fix that? So our mission overall is to promote the health of all families, as well as reduce inequities and improve outcomes. So we collaborate with state agencies, internally, Medicaid, people from the community, different stakeholders, both insurers, public and private, and many, many more. Next slide. So our whole entire health equity framework comes from the 3 frameworks in which we have at the Department of Health. So one is the life course framework, which you guys might have heard of, which is thinking more so on a whole life perspective. So thinking about, we don't just care about pregnant people or people who can become pregnant or just children. We care about the whole entire life course from when you're a baby all the way to an older age, and how your health is being affected and how we can help you to become better. We also have a racial equity focus and also are tuned into the DOH's 3 leading priorities and 5 strategies. Next slide, please. So some key facts. As you can see here, there are different things that affect populations. So thinking about lead poisoning. So the number of children who tested positive for lead poisoning decreased from 349 to 68 in the past 13 years. That's pretty good. But then when you look at Black infant mortality, that's 4 times higher than white infants. As well as Black women are almost 2 times more likely to have pregnancy-related complications. So thinking about hemorrhaging or other morbidities such as preeclampsia and things like that. Also, Black and Hispanic and non-Hispanic Asians women were more likely to have delayed prenatal care, so not getting it in time for their first trimester. So that's definitely something that we've looked at as well and thought about, well, how can we help women overall, and especially within these groups, to get better care and to make sure that they're getting the access that they need. As well as 1 in 3 families with children with special health care needs report not receiving needed care coordination. So when you have a child with special health care needs, it's very, it's a lot of different things going on. They probably have multiple different providers, multiple different health interventions that are going on. So it's very hard to coordinate all of that as a parent. So having support is really important. Next slide, please. So our program, we oversee federal funding, the Title V program. So it is a block grant. Block grants mean that it's usually a grant where it's very flexible in the funding. So it's not really designated for a set thing. So approximately $1.6 million we get a year, with the majority of funding going towards our health equity zones. So for those of you who don't know, health equity zones are basically the state has empowered communities, 15 different communities across the state to coalesce and come together and advocate, do initiatives, really dig into the things in which they need. So the department has helped with that, as well as the Mch program has helped to give seed funding to get that off of the ground. And they've grown out to 15 different communities and having different programs such as community health workers, substance use disorder programming, as well as pregnancy support groups and postpartum support groups. So in 2020, we completed a needs assessment, and then that emphasis of the needs assessment was thinking about addressing health disparities. Where are we investing, and is it data driven? Also, community input. We partnered with a community partner called Sister Fire. They're a women of color collective who are advocating for access and socioeconomic empowerment and mobility. So a part of that was really getting their input on what do women of color need and what do they think their children need, and how can we address that lack of access of care that they're seeing, or poor outcomes, as we saw in the last slide. We also had other things like family engagement, focus groups, and we also looked into evidence-based interventions. Next slide, please. Okay, so from that needs assessment, we were able to put together some priorities and strategies. As I said, that we have 6 health domains. So our first is preconception, pregnancy, and postpartum. So based on our work with Sister Fire, we realized that a really huge issue is the need to reduce our maternal morbidity and mortality. They have very high rates. They have very high rates of those things going on, and in relationship to their white counterparts, as well as having more prenatal disparities. So both of those, we chose both of those to address. As well with perinatal and infant health, we looked at strengthening the caregiver's behavioral health, as well as the relationship with the child. In child health, what we looked at was improving school readiness. So this is a part of the preschool development grant that really is invested in supporting the education and the intellectual, physical, and emotional development of children. So by the time that they get to kindergarten, they're ready to be there. Next slide, please. We also looked at adolescent health, our next health domain, and looking at, okay, so what are issues that adolescents are experiencing? And this is definitely at the beginning of COVID. So I think even during COVID, we've definitely seen a more need for help with mental and behavioral health support along those lines, as well as looking at children and youth with special healthcare needs. So ensuring effective care coordination. There definitely is a need for that when a child is 0 to 18, and then as they age out and transition to adult care. And then as well for cross-cutting. Cross-cutting means that it's an issue that cuts across all of our health domains. So thinking about how do we adopt social determinants of health, that mind frame, that thinking, that way in which we, that framework in which we have as the department, how do we adapt that in our planning, our practice? Basically the way how we think about our work, the way how we do our work to ultimately improve health equity. Next slide, please. Okay, so here are some of the strategies that we've implemented. So thinking about one program that we have is PDPRN and Mom's PRN. So that's a teleconsultation line for providers. So say you're an OBGYN and you realize that your patient might have mental health issues that they need support with. So as a doctor, you're not specialized in mental health. So you can call this line and talk to a consultant psychiatrist and say, well, I have this patient. Can you talk me through, one, the resources that are out there, and two, in terms of medications and things, if I were to prescribe, how would I do that? It's not just for prescribers, it's also for other healthcare providers, whether it be doulas or it be nurses or other types of individuals. All these different groups of people can call this line and really get at the matter of how do I help my patient. As well as PDPRN is for children and adolescents. Same thing with the providers being able to call that line. As well as family visiting has now implemented a depression screening. So looking at, well, they serve all of these different groups of people. So for those of you who don't know, family visiting is, as its namesake says, is that we employ different trained individuals to visit families and really help support them with the development of their child, whether it be physical, mental, and all these different things. So educating them as well as connecting them to resources. So part of that has been screening for depression and then forwarding them to resources. We also have a perinatal community consultant who worked on us with various projects, such as supporting the doula workforce, as well as contracting with Sistify. So one cool thing that Sistify was doing was thinking about, they had key learnings that they learned from interviewing over 300 women who had given birth at Women and Infants Hospital, 300 women of color. Of those key learnings, what they found is a lack of translation and empowerment of women of color. So really, really what they found is that women of color didn't really feel like they had a voice in their care. They didn't feel like they had informed consent. They felt discriminated against. They felt that they were already on edge going into the hospital due to other folks that they knew being treated badly. So when they got there, they were already on edge and then felt as if they weren't treated poorly, especially they were treated poorly, especially women who were non-English speakers, saying that their language, that what was going on in the hospital, the procedures and the interventions done wasn't fully explained to them, and they weren't empowered to make decisions. We also have an initiative going on where we have women of color being integrated into our MCH statewide committees and initiatives. So one initiative that we had, one test to do this initiative was Pregnancy Postpartum Death Review Committee. So that committee is a statewide committee that looks at all of our maternal deaths. So that's women who died during pregnancy and up to 1 year after giving birth is counted as a quote unquote maternal death. So we look at all those cases and we say, well, how could this death be prevented? How could we have done better? So then, as a result, we said, well, you can't just be providers. We need to involve the community, especially communities who are disproportionately affected by our perinatal, prenatal, delivery, and postpartum disparities, those who don't have as much access to care as well as poorer outcomes. So a part of that initiative was us getting 10 women of color from the community to serve on the panel and give input as we went through all these cases on how this death could have been prevented and how we can do better moving forward as a state. We just came out with our recommendations, which is a report on, out of all the cases that we reviewed thus far, it's a report on what the state and different entities within the state, whether it be providers, government, public, different public entities, what we could do better in order to prevent that death. Next slide, please. One moment. Thank you for waiting. So, child and children and youth with special needs and adolescent health. So, a part of this is making sure that children have access to care, as well as children and youth with special health care needs. They have adequate care coordination and support, and their families especially, who are taking care of them. So, a part of that is the Rhode Island Medical Home Portal, which is basically giving information at the fingertips of parents who really don't really understand their child's diagnosis, as well as they don't understand the resources present within the state. So that portal is paid for by the department, and we update it constantly, and push it to different community partners, as well as advertise it across the state. Any family can access it, and providers as well, to look at, to really cut out those Wikipedia pages and those different WebMD pages that you don't necessarily know what you're looking at, to really get at the crux of what is my child going through, what are the resources in the state, who can help me, and what are the best ways in which I can care for my child. As well as we've done HES mentorship in a learning cohort for MCH and preschool development grant related activities. So this long sentence is really about, we realized that the health equity zones, a lot of them had different ideas of what was maternal child health. And a lot of them didn't actually understand that they were actually doing maternal child health, because many different things affect families, especially the environmental, the social, the economic, all those different things. So what we've been doing is having different cohorts, which I will talk about later, cohort meetings, learning sessions to talk about different maternal child health issues and to bring nuances to the different issues as well. As well as we have the Youth Advisory Council and the Dare to Dream Conference. So the Youth Advisory Council is overseen by the department in collaboration with RIPEN, Rhode Island Parent Information Network, to really empower youth from across the state to coalesce around issues, as well as advocate and be a voice for youth and their needs, to multiple different programs in the department as well as across the state. They collaborate and do the Dare to Dream conference every year, which is a youth conference that empowers and educates youth on different things as well as really harnesses their voice during the conference and supports them in sharing their stories, especially for children and youth with special health care needs. As well as we've collaborated with Ripen and Family Voices and really dug into integrating a lot of families who have children with special health care needs into our structure at the DOH. So when we make policies about this group, we have them at the table. Next slide, please. Okay, so our cross-cutting health equity, looking at how we integrate our SDOH framework within our practice and planning. 50% of our funding goes towards health equity zones. So their mission, as I said before, is to encourage and equip neighbors and community partners to collaborate and create healthy places for people to live, learn, work, and play. So one example of them doing this work is looking at the COVID-19 response. The HES was instrumental in educating people on COVID-19 as well as giving them supplies that they needed in order to be safe, such as masks, sanitizers, all these different things, as well as there was a lot of pronounced economic needs during that time as well, and still persists today, where a lot of people needed to get connected to different resources that could support them during these trying times. So they were a part of that. So they worked and supported thousands of people affected by COVID-19 within the state for that response. As well, they have family navigators and community health workers who help parents and families on a daily basis with accessing their needs and were instrumental during the time of COVID as well. As well as housing inequity. So one issue that one of the HESs, well, multiple HESs are trying to get at is looking at housing and how do we create equitable housing. So, for instance, one HES, one neighborhood actually got a multi-million-dollar grant to start building affordable housing. So that's the example of how a community actually coalesces around an issue and really empowers themselves to address that issue. Next slide, please. Okay, so this is one of the examples that I had talked about. So the doula bill, the doula reimbursement bill passed around a year ago, just went into effect on July 1st. Doulas fought for 3 to 4 years on wanting to have reimbursement, because usually parents had to pay out of pocket. Insurance did not cover it. So for 3 years, they repeatedly fought to get this bill passed through legislation in Rhode Island. So when it did pass, what it did is that it mandated public and private insurance to pay for doulas. And then on top of that, paved the way for them to get certified and all these different things. But one thing that we realized was the fact that of all the 100 doulas that we have in Rhode Island, very, very minuscule amount, 9 that we could identify, were women of color. So we said to ourselves, how do we increase that? How do we support that? So what we ended up doing was creating about a $250,000 project on a doula initiative that would basically, from start to finish, pay for trainings, pay for certifications, all the things that a person of color needed in order to become a certified doula, up to the point up to the point where we paid for their $50 certification application. Next slide, please. So here's our first training on 11/20/21. It was hosted at Neighborhood Health Plan. So we had over 17 participants come, all passed their test at the end of the program, as well as they received Doula Bags. So Doula Bags are basically everything that a doula will need on the daily basis, whether it be educational material in different languages, as well as different example pieces, such as when you're teaching your mom how to breastfeed, we gave them a silicone breast so that they can show them how to do it. What else did we do? Oh, we also gave them a dilation wheel. So a dilation wheel is looking at, all right, so a mom doesn't know she's dilated fully enough, like her cervix is open enough for the baby to come out. It usually has to be 10 inches. So what the dilation wheel helps is to help the doula and the patient to look at the dilation of their cervix and to really think more fully on whether or not they should be going to the hospital with them to have the baby as yet. So as well as we had other things within that bag. Next slide, please. So we had another 3/20/22 training, and 10 participants ended up attending. Next slide. So here are some pictures from our March doula training. So we had different participants, and this was held in the Department of Administration. And you see on the left corner, we were doing different exercises that doulas could utilize to support a woman who were dealing with different pains from pregnancy and birthing. Next slide, please. As a note, we contracted with a women of color-led training organization, the Common Sense Childbirth Institute, as well as we partnered with for implementation planning from the beginning to the end. We partnered with a community organization, Journey, that specializes in perinatal education in order to implement this. So really at the crux was empowering women of color, organizations of color to do this work and to empower other women to step into this field. Next slide, please. Okay, so overall, and then we have about 6 months that we're paying for of Journey, our community partner, to do workshops and one-on-one mentorship with the upcoming doulas. So supporting them as they get certified, as they do everything that they need to do, as well as sign up for insurance and put in their claims for insurance as well. As well as we have membership and access things as well. So looking at different collectives and networks that they could be a part of, and we paid for those memberships. So the Birth Workers Collective was looking at admin and billing, supporting doulas on that. So we gave them the year-long membership to that, as well as RI Doulas of Color Network. We paid for a year-long membership. That's a network of doulas of color who come and coalesce and support each other. And then also One Neighborhood at a Business Center, and they connected many of the people there so they could support that. And then also the Doula Agency. So some doulas, the way how the legislation was put that is that most doulas, they tend to be by themselves while they practice. They tend to be entrepreneurs. Some doulas don't want to do that. Some doulas want to just, take clients, but they don't want to deal with the business aspect of it. So the agency allows the doulas to subcontract and to take clients, but not have to do that business aspect. Next slide, please. And also, as I had said before, the MCH has learning cohort. So it's a bi-monthly cohort, and we've covered various issues like Black maternal health, youth empowerment, substance-exposed newborns and families and pregnant people affected by substance use disorder, as well as children and youth with special healthcare needs and different resources out there. So within each of these different cohorts, we've had people from the community, particularly people of color from the community, who have come and talked about their experiences, how the health equity zones in the state can really dig in and get at the crux of the issues in which they're facing. And then we've had discussions like 20 to 30-minute discussions where the HESs really dig into how they can support this issue, how can they have more nuances when they implement their work, that nuances in their work that get at the different issues that we're talking about. Next slide, please. So that is all that I have for you guys. Do you guys have any questions? Oh, one person raised their hand. Oh, Natalia, go ahead.
Hello, thank you so much for your interesting presentation. First I introduce myself. I'm a Brown student, MPH Brown student. I'm from Ukraine. So I have a couple of questions. So the first one is about your cooperation with schools of the state. Do you have any cooperation with schools on the level of schools? I mean, maybe some for example, just you provide guidance for food providing to children, like number of sweets or number of, I don't know, veggies and fruits they have to provide, I mean, in school menu. And the second question, I know that in Rhode Island you have an early intervention program for families who has children with disabilities. Can you tell a little bit about this program? Thank you.
Oh, definitely. I would be happy to. So this program is really early intervention is a program that, say you have a child, a young child. I think it's between, I can't remember the ages, but I think the cap for being in early intervention is around 5. But basically, that program, say for instance, you're in a doctor's office or you have a family visitor coming, and you say, well, it seems that my child might be having an issue with this, or you figure out some way somehow that your child may have a developmental issue. Oh, one second. Basically, what ends up happening is that provider who helps you to understand that your child may have a disability or a developmental delay. What they do is that they forward you to early intervention. So I believe that is like a phone call that you can make or your provider can make, a referral as well. And then you get reached out to by early intervention, and then you can set up with the program itself to come, or they come to your house to help with the overall development of your child. So they have different trained providers who assist, as well as connect you to different resources. In terms of, I think you were asking me a question about what are the different ways in which we support like children and youth in terms of like food and like access to health. Is that what you were saying? Well, in terms of that, in terms of supporting children and youth with access to food and to health, so there's the Adolescent Health Program run by Sanavan Pantavan, and she really gets at youth health as well as support. These are overarching titles. These are overarching programs that support overall like policy and implementation. I think within the schools themselves, they support. They have internal programs for like breakfast and food for children who qualify. I don't know of any programs that really are implementing that right now, but I do know the health equity zones themselves have food banks as well as collaborations with food institutions that allow them to give access to food and support the families who are in need of it. Hope that answers your question.
Yeah, thank you.
Great. Anybody else? Go ahead.
Hi, Aida. Thanks so much for that presentation. I have a question about the doula coverage bill. It's so exciting it's finally in effect, but just kind of like looking forward with doula services, like do you think the demand for doula services is really going to increase now that there is coverage? And or like do you think the amount of doulas getting trained is going to increase? Kind of just like what do you think looking forward for both like providing doula services and people who really want to access those services? Thanks.
So from what we've heard from our doulas who we have collaborated with, from what we've heard from them is that even before July 1 went into effect, people are already asking for doulas, and providers were forwarding them to doulas, even though the insurance had not gone into effect yet. So yeah, that was definitely a catch-22 that people were having. But yeah, I think people and providers are pushing it that people should get doulas. From what we've been hearing from our collaborators, like some people are booked out like for a year for birth. So there is definitely, I feel, going to be more of a demand than a supply. But as those doulas of color come in, that they'll help to fill that demand as we go along. But yeah, I do feel like there'll be more of a demand than there is a supply. Any other questions?
I think we are good. There's no questions in the chat.
Okay, well, thank you all for having me, and I hope that I gave you different nuggets of information. Thanks again, Jen, for having me.
Of course. Thank you so much.
Bye.
Bye everyone.
Thank you. Bye.